part of the basic dermatology curriculum organized by the Saudi Society of Dermatology and Dermatologic Surgery. So our topic for tonight will be wart and molluscum, and these are our learning objectives or agenda and outline for tonight. So we'll be discussing overview and type of wart treatment, overview about molluscum, and at the end molluscum treatment. So basically, what are common cutaneous or mucosal viral infection caused by human papillomavirus? What can occur in all age group, although it's more common in children and in immunocompromised patients, including HIV patient in immunosuppressive therapy, and post-renal and hepatic transplant patients. So it's quite common. So HPV is double-strand DNA in an enveloped capsid virus. And there are over or more than 200 types of human papillomavirus. In terms of mechanism of transmission, it could be sexual, causing genital wart. It could be related to skin contact, causing cutaneous wart. It's also worth to be mentioned that the incubation period is from 1 week and can be up to 1 year, and most of the cases will regress without any treatment in about 20 years or less. So wart or HPV can affect fully differentiated squamous stratified uh, epithelium in the basal layer. And finally, treatment of wart can be medical or surgical depending on the clinical situation. So basically, we can subdivide HPV or wart to four main subcategories. It could be cutaneous, mucosal, congenital, or as syndromatic. So we will be starting with the cutaneous. So we have three subtypes of cutaneous warts. Number one, common wart, which also known as Verruca vulgaris. Second one, palmar and plantar wart, which also known as Verruca palmaris et plantaris, and flat wart, which also known as Verruca plana. So common wart, characterized by hyperkeratotic, exophytic, dome-shaped papules or plaques, which caused by type 1 and type 57 HPV, and most of the time will be located over finger and hand. So we might have sub or periingual wart involvement, mainly in nail bitter patient, and most of the time it will be caused by HPV 16, and that will increase the risk for periingual squamous cell carcinomas. So in addition to that, we might have a type called filiform wart, characterized by smooth, surface slender projected papules, occur mainly over head and neck and eyelids. So moving to the second type, palmoplantar wart, we can also subdivide it into two subtypes or two categories. First one is myrmecia, which characterized by deep, painful, solitary papule or plaques, mainly caused by HPV 1, 2, or 57, and most of the time will be affecting the weight-bearing areas. Moving to the second subtype, which is mosaic wart, usually it's considered to be plantar wart that coalesces into large plaques. So moving to the last subtypes of the cutaneous wart, which is flat wart. So characterized by skin colored or pinkish to brown, smooth surface, slightly elevated flat topped papules, and most of the time it will be caused by HPV type 3 or 10. So also worth to be mentioned that we have subtypes called butcher wart, which is common in facial processing professionals. Most of the time will be caused by HPV type 7. So, in summary, we have three subtypes of cutaneous wart. Number one, the common wart. We can also subdivide it to periingual or filiform wart. The second type, palmar and plantar wart. We can also subdivide it to myrmecia or mosaic wart. And the last subtypes is flat wart. So this is very important slide. It's very important to differentiate between corn and wart, knowing that wart is caused by HPV or is it infectious in nature compared to the corn. So we have three main difference between corn and warts. So number one, corn is non-infectious. Most of the time, it will happen over friction or pressure areas, and the term of appearance characterized by round hard spot with a clear center, and most of the time there's going to be no black dot and will not bleed without when we scrape it. So This table highlight and summarize the clinical manifestation and associated human papillomavirus type. So, for example, in Butterworth, the HPV is 7. In digital squamous carcinomas, it will be 16. And also in pigmented wart, it's gonna be 65, and in sublingual, in pigmented, it's gonna be 65, and the sublingual gonna be 57. So most of the time, the diagnosis of what we're gonna be clinical. However, sometimes we are in doubt. We can do always skin biopsies, and skin biopsy will show hypergranulosis, acanthosis, and papillomatosis, as you can see in this pathology pictures. So moving to the mucosal wart, it's 40 we mentioned that it's caused by more than 40 HPV types, and most of the time it's going to be subclinical rather than visible wart. So we have three main subtypes of mucosal wart. It could be oral, genital, or respiratory. So why it's very important? Because mucosal wart increase the risk for squamous cell carcinomas. So we have to be aware of mucosal wart. So uh, starting with the mucosal wart or the genital wart, we have four subtypes. First one, genital wart called Contagiosum acuminata, characterized by smooth sessile papules. Most of the time, it's going to be caused by HPV 6 and 11. And as we have mentioned earlier, it might increase the risk for squamous cell carcinoma, especially in HIV patients. So we have the second type, which is called bonoid papulosis, characterized by multiple brown papules and small and smooth plaques over genital area. Most of the time, in pathology, it's going to show high-grade squamous interepithelial lesion, and it might progress to squamous cell carcinoma, especially with type 16. S- So the third type is erythroplasia of curate, which is quite uncommon. However, it increases the risk for squamous cell carcinoma in most of the patients, so we need to be aware of it. In terms of clinical presentation, it's characterized by well-demarcated red smooth plaque over penis or vulva. So moving to the last subtype, it's called giant condylomata acuminata, characterized by large exophytic cauliflower-like tumor mass. Most of the time, going to be caused by HPV 6 and HPV 11. Also, patients with giant wart will be at increased risk for squamous cell carcinomas. So, moving to the second subtypes of mucosal wart, which is oral wart, we have two subtypes. The first one is oral fluid papillomatosis, which known as acriman tumor, and the second one is focal epithelial hyperplasia, which known as Hick disease. So, in terms of acriman tumor, it's characterized by multiple confluent water lesion on oral cavity or over the nasal sinus. Most of the time, again, caused by HPV 6 or 11, and smoking, radiation, and chronic inflammation are risk factor to have oral fluoride papillomatosis. Moving to the second part, Hick disease, characterized by multiple plaques over gingiva, buccal, or labial mucosa, mainly caused by HPV 13 or 32, and it's more common in Native American people. So, moving to the last type of mucosal wart, which is respiratory wart, or as known as recurrent respiratory papillomatosis. There is triad, consists of hoarseness, stridor, and respiratory distress. Most of the time in examination, as you can see, you're gonna have benign exophytic, benign laryngeal papillomatosis, and most of the time it's gonna be caused by HPV 6 or 11. And patient with recurrent respiratory papillomatosis will be at increased risk for squamous cell carcinoma, and radiation, smoking, chemotherapy considered to be high risk factors. Also, it's worth to be mentioned that laryngeal carcinoma most of the time will be caused by HPV 30. So, moving to the congenital subtype of wart, which called epidermodysplasia verruciformis, it's a very rare autosomal recessive inheritance disease causing multiple wart, and it's caused by mutation in EVR1 or 2 gene. So, we have two syndromes that associated and cause multiple numerous wart. The first one was called WAHM, which is autosomal disease, rare, and there's going to be mutation in CXCR4, characterized by wart, hypogammaglobulinemia, infection, and retention of mature neutrophils in bone marrow. However, the second syndrome, called WAD, caused by JATA2 deficiency, characterized by wart, immunodeficiency, lymphedema, and dysplasia. So in summary, we have four subtypes of wart, could be cutaneous, mucosal, congenital, or syndromatic. In terms of mucosal, we have three subtypes: oral, anogenital, or respiratory. In terms of anogenital, we have condymata acuminata, Bashkil-Austin syndrome, and bound papulosis, and erythrodysplasia of Kennett. So, moving to the last part of wart treatment, so we have several factors. So, without a treatment, most of the time patient will have spontaneous resolution. However, there is a high recurrence rate and will be up to 60%, and we need to also avoid the treatment with scarring such as liquid nitrogen or electrocautery. So, treatment of wart could be destructive, cytotoxics, or immunomodulator. So, and we have three FDA approved treatments, could be imiquimod, interferon alpha, and budophilin. So we can subdivide the treatment for what to procedural or topical treatment. So we can always consider cryotherapy, electrosurgery, curettage, excision, or laser, either fractional or BDL. Also, we can also consider photodynamic therapy. In terms of topical treatment, we can always consider TCA, salicylic acid, and lactic acid, and imiquimod. So we have cytotoxic treatments such as budophilin or budophilin toxin or 5-FU. We have keratolytic agents such as tretinoin, and we have imiquimod, which is toll-like receptor 7 activator. So, in terms of vaccine, which is considered to be preventive and also as a treatment, we have three subtypes of FDA-approved HPV vaccine. The first one called cervix, which will be covering HPV 16 and 18. Also, we have Gardasil, will be covering HPV 6, 11, 16, and 18. And we will be having Gardasil 9, which is available here in Saudi Arabia, which will be covering almost 9 type of HPV. So in summary, if we have single or solitary lesion, we can always consider cryotherapy with topical treatment. If we have widespread mucosal or cutaneous wart, we can always consider topical treatment. We can always consider cryotherapy or immunomodulator injection. In terms of mucosal wart or anogenital wart, we can always consider topical treatment, mainly imiquimod or budophilin, plus minus cryotherapy and surgical intervention. So, in terms of PPD injection, we have published two articles, and that showed that PPD injection is very effective in treatment resistant wart and immunocompromised and immunocompetent patient. So, this is the first question. So, we have 25 years old male with solitary wart. What is the best treatment option? So, what do you think? So, in terms of we having solitary wart, we can always consider cryotherapy plus minus topical treatment. So, the answer gonna be D. So, on solitary wart, we can always consider cryotherapy plus minus topical treatment to have or to achieve better result. So, moving to the second question, 65 years old female, immunocompromised with multiple warts, what is the best treatment options? So, what do you think? So, as you can see, this patient have multiple disseminated warts over the hand. So, I believe we need to do immunotherapy because immunotherapy will trigger the immune response and will help in clearing warts. So, the best treatment option here will gonna be immunotherapy. You can do candidal antigen or you can do BPD injection. So, so Below condition can caused by which type of HPV? So what do you think? Yeah, so most of them get caused by HPV 16, as know that HPV 16 and 18 will be the major causative in mucosal or anogenital warts. So moving to molluscum. So molluscum is a common self-limited condition in children caused by molluscum virus, which is a member of box. So we have four types of molluscum. Uh, Type number one is most common and most prevalent in children. Type two usually seen in adult and HIV patients. Also, it's worth to mention that molluscum transmitted by direct skin to skin contact, especially in very wet skin. In terms of clinical presentation, a molluscum characterized by a firm, implicated, barely smooth papule with waxy surface. So it's worth to be mentioned that in immunocompromised patient, a male HIV patient, the molluscum will be widespread and might involve face and genital lesion and can be a very giant or large molluscum. So, in terms of pathology, it's gonna show large intracytoplasmic inclusion body, or as known as molluscum bodies or Henderson-Buxton body within the epidermal keratinocyte. So, in terms of treatment, molluscum can be treated similar to warts. We can always consider topical treatments such as imiquimod or budofilin. We can always consider curettage, chemotherapy, and other surgical intervention. Also, it's worth to mention that in most of the time within 1 year, a molluscum will be resolving simultaneously without any intervention. So, in summary, what are common cutaneous viral infection caused by human papilloma virus? Mucosal wart increase the risk for squamous cell carcinoma and considered to be a major risk for cervical cancer. Wart treatment can be cytotoxic or destructive. The currently approved vaccine is Gardasil 9, which protects against 9 subtype of HPV virus. So thank you.
يعطيك العافية دكتور فارس، وشكرا
الله
لك.
يعافيك.